In tonight's Health Watch, listen to this. The U.S. right now having its worst year for the spread of measles in more than 3 decades. The CDC now saying the case count is at 1,288 nationally, and there are still another 6 months to go in 2025.
Joining us to discuss the outbreak is Dr. Warren Seigel, a pediatrician at NYC Health and Hospitals. Dr. Seigel, thank you so much for the time. Can you tell us why in the year 2025 we're seeing such a resurgence of a disease that was once considered completely eliminated?
This is so sad, and thank you for doing this segment. This is so important. Vaccines were the American success story. We almost had eradicated this disease. World Health Organization in 2000 declared measles eradicated from the United States. But we're seeing it back, as you said, because of questions about its efficacy. And the truth is, vaccines work.
So, doctor, if resistance is waning and people are infected, how often are these patients needing hospitalization? And also, what are the symptoms that we need to be looking out for? Because for so many of us, as you mentioned, aren't even familiar with this.
We haven't seen this in years. So a child who comes in who has not been vaccinated, who presents with a high fever, a cough, the runny nose, so many parents will say, okay, that's just a cold. But then the rash hits. The really upsetting part is that 3 to 5 days after symptoms start, that's when the rash starts, and that whole entire time that child has been infected. So it's important that every child get their vaccines and every person get their vaccines, 2 vaccines. One, normally we give between 12 months and 15 months, and the other at entry of school age, 4 to 6 years of age. So the best way to keep from getting measles is to get vaccinated.
And on that point, we talked about vaccine hesitancy. Like it or not, it is a thing right now. What would you say, what do you say to your parents, your patients who are hesitant about getting their children vaccinated?
You know, as I said, vaccines are a success story. What we need is not the rhetoric that we're hearing. What we don't need is the questions. What we do need is the information to get out there and the education. Vaccines work. They are safe. We know that they work. We know that they're safe. And if parents have a question, they should talk to their pediatrician.
Dr. Warren Seigel, appreciate you joining us.